So in this case, we're performing a colonoscopy and gastroscopy on a patient. And here's the clinical note and assessment. This is the first tab among the other tabs, which include preparation and sedation, each of the procedures, in this case colonoscopy and gastroscopy, then a combined impression and plan tab, and then an opportunity for the endoscopist to review the note in the format that it'll be saved and printed. So starting with the clinical note and assessment, we recommend that you start at the beginning of the overview, and we'll note that the data is pulled from the surgical registration system, or ORSOS. And in this case, the procedures are performed at the bedside, and that's why it's indicated this way on the ORSOS case number. Verify that we are performing the correct procedures, in this case colonoscopy and gastroscopy. And then you can see endoscopy unit, the endoscopist's name have been pre-populated from ORSOS, as has the admission hospital. Now the documentation field in terms of documented by is a mandatory field, and in this case I can look through this searchable directory of various endoscopists, including trainees, to indicate that I am the person that's completing the note. The reason that we incorporated this is there may be cases where the most responsible endoscopist is not the person doing the documentation. It may be a trainee, fellow, or another colleague. So once you've glanced and completed the overview, you can then take a look at the pre-procedure diagnosis clinical indications. As you can see, none of the fields here are mandatory, but it's recommended that you pick at least an indication for moving ahead for your future reference. And that may be done using any of the check boxes below or using the search screen. So I'll demonstrate both of those. In this case, if the person was referred for evaluation of lower blood loss, for example, when you click on the field, it can be expanded into acute bleeding, and the endoscopist can enter details as to the duration, the severity, etc. Or if they wish, they could just type in key medical words such as hematochezia into the search box, and you see it'll take you right down there. In many cases, there may be multiple indications, and those can all be done in a combination of the drop-down list and the search box. Progressing further down, you can see that there are other elements of the clinical history here, and it's pre-populated with the initial statement of the patient is indicating their age and their gender. This box may then be populated by typing in further details, or comorbid illnesses may also be specified. And here you can see that we've used it. We've used the most common comorbid diseases that have been associated with endoscopies in the past, and it allows the endoscopist to pick up illnesses such as heart disease, and then they can continue to add, for example, diabetes and any other comorbidities that they wish. Those can also be free texted in the clinical history field. However, if they're taken as unstructured text under the clinical history, they're not as easily to search if in the future the endoscopist or the unit wish to analyze this in a more synoptic way. Family history details. At this point, we've left a box where family history details may be documented by the endoscopist. And then there are a number of panels here where physical examination may be indicated. If it's normal, you can just pick normal. If there are any abnormalities, then those may be documented within the various boxes that are provided. In the case of perianal and digital rectal examinations, we've pre-populated with some of the more common findings that are reported there to reduce the amount of data entry. So that completes the clinical note and assessment tab. In summary, start at the top, take a look at the overview, and work your way down through the indications and any aspects of the history and physical examination that are appropriate for the patient. Remember, this is not intended to be a full substitute for the entire medical history. And from the perspective of the endoscopy report, we encourage endoscopists to include as much detail as they feel is appropriate.